Welcome back to another Deep Dive Med.
Oh, yeah.
All right, so today we're diving into a fascinating world
Uh,
that you might not think is that fascinating,
yeah.
but trust me, it is, and that is mucus
Mucus, yeah.
and mucociliary clearance.
It's more interesting than it sounds.
Yeah, it is. So we're going deep into a pharmacology lecture that really breaks down this whole system, especially when it comes to respiratory health.
Yeah, it's something that a lot of people don't really think about. We all think about mucus when we get sick.
Right, exactly.
But, there's so much more to it.
Yeah, and I think most of us associate mucus with being sick, but apparently our lungs are producing a lot of it all the time, up to 100 milliliters a day. Is that right?
It is. It is. And I know that sounds a little gross,
It does.
but it's really important to remember that mucus is a vital part of keeping our lungs healthy. It's not just some random gunk. It actually has a lot of important jobs.
Okay, so like what?
Well, for one, it acts as a lubricant, so it helps prevent our airways from getting irritated.
Okay.
And then it also traps and neutralizes all sorts of harmful stuff that we breathe in, like bacteria and viruses.
Oh, so it's kind of like flypaper for germs.
Exactly. And it even helps regulate the water balance in our airways, preventing them from getting too dry or too wet.
Wow. I never realized mucus had so many jobs. But how does it actually get cleared out of our lungs? We're not constantly coughing up 100 milliliters a day.
Right. Well, that's where the mucociliary clearance system comes in.
Okay.
So lining our bronchial tubes, we have these tiny hair-like structures called cilia,
Okay.
and they beat in this really coordinated rhythm, sweeping that mucus upward towards our throat where it can be swallowed or coughed out.
So it's like a constantly moving escalator for mucus.
Yeah, I like that analogy.
Okay.
It's a really efficient system, but there's a catch. So cilia are only present in the bronchi, not in the alveoli, those tiny air sacs where gas exchange actually happens.
Right.
That's a key distinction.
Okay. So what happens if mucus reaches the alveoli? That can't be good.
You're right, it's not good. If mucus builds up in the alveoli, it can block airflow and make it difficult for oxygen to get into the bloodstream.
Oh, wow.
And it can also create a breeding ground for bacteria, which increases the risk of infection.
So it's pretty important to keep that mucus escalator running smoothly.
It's essential. And that's where understanding what can impair mucociliary clearance becomes so important. And the lecture highlighted several factors, but one of the biggest is dehydration.
Right.
If you're not drinking enough fluids, your mucus can get thick and sticky. And that makes it really hard for those cilia to move it effectively.
So staying hydrated is important for more than just quenching your thirst.
Absolutely. It directly impacts the health of your respiratory system. And it's not just dehydration. There are other things that can thicken mucus as well.
Like what?
Well, conditions like chronic bronchitis and cystic fibrosis, for example.
Oh, right.
Those also lead to thicker mucus, which makes clearance more challenging.
What about things like asthma? I know that involves inflammation in the airways, so I imagine that could affect things too.
You are absolutely right. Bronchoconstriction, like what happens in asthma, can narrow the airways, making it harder for mucus to move freely. And inflammation itself can actually damage those delicate cilia, impairing their ability to sweep effectively.
So anything that messes with the consistency of the mucus or the movement of the cilia can really throw the whole system off.
Exactly. And the lecture pointed out another kind of surprising culprit: high oxygen concentrations.
Really? That seems counterintuitive. Wouldn't extra oxygen be a good thing?
Well, you would think so, right?
Right.
But research actually shows that high oxygen levels can slow down the beating of those cilia,
Oh, wow.
making them less effective at clearing the mucus.
Interesting.
So it's something to consider, especially for patients who are on supplemental oxygen.
So it's a delicate balance.
It really is. And then there's the unique challenge of endocrichial tubes, like what they use for patients on ventilators.
Right. Those bypass the upper airway, so I imagine that could affect mucus clearance.
Absolutely. Because they bypass the natural warming and humidifying process that normally happens in the nose and throat.
Okay.
The mucus inside the tube can become thick and dry, which can actually obstruct airflow.
And I assume the tube itself is pretty irritating to the airway.
Yeah, it can be. And since there are no cilia present inside the tube, the body can't clear the mucus naturally.
Oh, okay.
So it's kind of a vicious cycle.
So managing secretions becomes a really critical part of care for intubated patients.
Absolutely essential. And that's actually where pharmacological approaches can really make a difference.
Right.
The lecture covered 3 main ways that medications can help. One is by increasing the liquid layer in the airways. Another is by altering the consistency of the mucus. And the third is by improving ciliary action.
It's all about making the mucus easier to move and helping those cilia work more effectively.
Exactly.
All right, so let's talk meds. What are some of those pharmacological approaches to improving mucus clearance?
Well, one way is to actually boost the function of the cilia themselves.
Okay.
Things like sympathomimetic bronchodilators and corticosteroids, those can be really helpful.
Oh, okay.
Yeah. So bronchodilators, those help open up the airways, giving the cilia more room to work.
Okay.
And corticosteroids, they reduce inflammation, which can actually damage those delicate cilia.
So it's not just about the mucus itself.
Right.
It's also about creating a better environment for the cilia to actually do their job.
Exactly. And then when we're dealing with really thick, stubborn mucus,
Right.
we've got another tool, mucolytics.
Mucolytics.
Yeah, these medications work by actually breaking down the bonds within those complex mucopolysaccharide molecules.
Okay.
So they make the mucus less viscous.
So they're not dissolving the mucus entirely. They're
Mhm.
just kind of changing its structure to make it flow more easily.
Exactly. And there are two main types of mucolytics that are approved for use, acetylcysteine and Dornase alpha.
Okay.
And they have slightly different mechanisms of action.
Okay, so how do they work?
So acetylcysteine, that targets disulfide bonds within the mucus molecules,
Okay.
kind of like snipping apart tangled chains.
Oh, okay.
Dornase alpha, on the other hand, that breaks down DNA in the mucus,
Okay.
which also contributes to its stickiness.
So they're kind of attacking the problem from different angles.
Right.
Makes you wonder if, like, combining them would be even more effective.
Yeah, it's a great question, and it's something that researchers are actually exploring. But like with any medication, there are important considerations.
Right.
For instance, acetylcysteine can sometimes cause bronchospasm in certain individuals, so it's often given after a bronchodilator to open up the airways first.
Oh, okay.
And Dornase alpha requires refrigeration and specialized nebulizers for administration.
Oh, wow.
So it's not as simple as just popping a pill, unfortunately.
So it sounds like using these medications effectively really requires a good understanding of both their benefits and their potential drawbacks.
Absolutely. It's about finding the right tool for the right job, so to speak.
Right.
Now, shifting gears a bit, let's talk about those good old-fashioned remedies like drinking plenty of fluids. Does that actually help thin the mucus?
Yeah, that's what I was wondering about. It seems intuitive, but I know that simply pouring water down your windpipe isn't exactly a good idea.
No, you're right. It can actually be quite irritating, and it can even trigger bronchospasm.
Oh, wow.
But bland aerosols, like water or saline, they work a bit differently.
Okay.
So instead of directly diluting the existing mucus, they actually stimulate the cells in the airways to produce more of that thin, watery mucus that's easier for the cilia to move.
So it's more about like kickstarting the body's natural mucus clearing mechanism
Right.
rather than just adding more liquid to the mix.
Precisely. And when it comes to these bland aerosols, there are actually several different types with specific properties and uses.
Oh, okay.
Sterile water, for example, is free from microorganisms.
Okay.
And it often contains bacteriostatic additives to prevent bacterial growth.
Right.
Distilled water is also sterile, but it can be more irritating. And it lacks those antibacterial properties.
Yeah.
Then we have normal saline, also known as 0.9% sodium chloride, which is isotonic to our body fluids, meaning it has the same salt concentration.
Right.
So it's generally well tolerated, and it's often used to dilute medications for nebulizers.
Okay.
Hypotonic saline, that one only has 0.45% sodium chloride, so it's even less irritating.
Okay.
And that's mainly used with certain types of nebulizers.
So we've got a whole spectrum of options here, from less irritating to more irritating. What about on the really irritating end?
Well, on that end, we have hypertonic saline, which is a much more concentrated solution of 5–10% sodium chloride.
Okay.
It's so irritating that it's primarily used for sputum induction.
What's that?
That's basically provoking a cough to obtain a sample of mucus for analysis.
Oh, okay, I see.
Yeah, so I can see how that would be helpful for diagnosing certain conditions.
Right.
But it sounds pretty intense. It can be, and its effects can vary depending on the underlying lung condition.
Oh, really?
Yeah, for example, in COPD, it can actually worsen lung function. How?
By triggering bronchospasm. But in cystic fibrosis, where thick mucus is a major problem, it can actually improve lung function by helping to clear those airways.
Huh, that's so interesting how the same treatment can have such different effects depending on the individual's condition.
Yeah,
It really highlights the need for personalized medicine.
absolutely. Now, switching gears again, let's talk about expectorants.
Okay.
These are medications that help loosen mucus and make it easier to cough up.
Okay.
One of the most common ones is guaifenesin, which you might recognize from over-the-counter brands like Mucinex or Robitussin.
Oh, yeah, I've seen those. But how do they actually work? Do they, like, directly thin the mucus?
Not quite.
Huh.
Guaifenesin works in a couple of ways. First, it stimulates the vagal nerve,
Okay.
which triggers a reflex that increases fluid production in the airways.
Okay.
And it also seems to have a direct effect on the glands in the airways, encouraging them to produce thinner mucus.
Okay.
So this combination makes the mucus easier to cough up. So it's a two-pronged approach. Increasing fluid and stimulating a more productive cough.
Yeah, and that kind of brings us to the question of cough suppressants.
Right, because why would you want to suppress a cough if the goal is to clear the mucus?
It seems counterintuitive, right?
Yeah.
But sometimes a cough can be dry, hacking, and unproductive,
Huh?
which can be really irritating and actually make things worse.
Okay.
So in those cases, cough suppressants can be helpful in reducing that unproductive coughing.
So it's not about eliminating the cough entirely.
Oh, right.
It's more about making it more effective.
Exactly. We want a cough that actually helps clear the airways,
Right.
not one that just irritates them further.
Gotcha.
The main types of cough suppressants are opiates, like codeine, and non-opiates, like dextromethorphan.
So there are options depending on the severity of the cough and the individual's needs. But are there any situations where you definitely wouldn't want to use a cough suppressant?
Absolutely. You should never give a cough suppressant to someone who has thick secretions they need to clear. Because suppressing the cough in that situation would prevent them from expelling the mucus, which could lead to serious complications.
That makes perfect sense. You need that cough reflex to actually get the gunk out.
Right.
But I've seen medications that combine expectorants and cough suppressants. That seems like a contradiction. How does that work?
It might seem counterintuitive,
It does.
but the idea is to thin the mucus with the expectorant and then use the cough suppressant to dampen down the cough reflex just enough to allow for a more controlled, productive cough.
Oh, so it's like fine-tuning the system,
Right.
make the mucus more fluid, and then make the cough just strong enough to actually expel it effectively.
Exactly. Now, before we wrap up, I want to touch on one more situation where mucus management is particularly critical: premature infants.
Right. I remember reading about surfactant deficiency in preemies. That's not directly related to mucus, is it?
No, it's a different issue, but it also highlights the importance of a healthy respiratory system.
Right.
So premature infants, they often lack sufficient surfactant, which is a substance that helps keep those tiny air sacs, the alveoli, from collapsing.
Right.
And without enough surfactant, the lungs have to work much harder to breathe, and the baby can develop respiratory distress syndrome.
So it's not about excess mucus in this case, but rather a deficiency in a substance that helps the lungs function properly.
Exactly. And the treatment for this is surfactant replacement therapy,
Oh,
where they administer surfactant directly into the baby's lungs.
wow.
It's a really remarkable intervention that has saved countless lives.
This deep dive has really opened my eyes to how complex our respiratory system is.
Yeah, it's one of those things we don't really think about.
Right, until something goes wrong.
Yeah, exactly.
So to wrap things up, what are some key takeaways our listeners should remember about mucus and mucociliary clearance?
Well, I think the most important thing is to remember that mucus is not the enemy.
Right.
It's actually really a central part of our respiratory defense system. And mucociliary clearance, that's the unsung hero that keeps everything moving, keeps everything working properly.
It's like a 247 cleaning crew working tirelessly to protect our lungs.
Exactly. But when that system is disrupted, whether it's from dehydration, smoking, certain medical conditions, or even some medications, that's when we can run into problems.
So paying attention to our mucus,
Yeah.
noticing any changes in color, consistency, or amount, that could be a sign that something's off.
Absolutely. And if you notice any kind of persistent changes, it's always a good idea to just check in with your healthcare provider.
Right.
Because we talked about a lot of different medications that can help manage mucus, but there's no one-size-fits-all solution.
Right. It seems like the best approach really depends on the individual, their underlying health condition, and the specific problem they're facing.
Exactly. It's all about personalized medicine, finding the right tool for the job. And sometimes the best approach might not even involve medications at all.
Really?
Yeah. Things like staying hydrated, using a humidifier, practicing good cough hygiene, and even certain breathing exercises, those can make a big difference.
So it's really a holistic approach,
Uh-huh.
looking at all the factors that can influence our respiratory health.
Couldn't have said it better myself.
Ooh, great.
Now, before we sign off, I want to leave our listeners with a little something to ponder.
Okay, shoot.
We've learned that our lungs produce a pretty remarkable amount of mucus every day.
Yeah.
But what happens to all that mucus once it's cleared from our airways?
That's a good question. I've never really thought about it before.
Well, there you have it, listeners. A little homework assignment for you.
Yeah.
Do some digging and see what you can uncover about the fate of our mucus.
Okay.
It's a surprisingly fascinating journey.
Well, all right, everyone. That's a wrap for today's deep dive on mucus and mucociliary clearance. Thanks for joining us.
It's been a pleasure exploring this often overlooked but very important system with you.
Don't forget to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.